I'm Dr. Jayaram, consultant family physician at Kamakshi Hospital in Medavakam. So today we are going to see a topic which is most prevalent, pre-diabetes, and how to prevent yourself from becoming a diabetic. So this is what we are going to see today. So the world data on diabetes across the globe, which is around 183 million people has been affected with diabetes. So among them, the WHO data says 2030 there will be 552 million people would be affected with diabetes worldwide. So this is something which is a global burden and which we have to prevent in becoming a diabetic person. What is the prevalence of pre-diabetes in India? So the prevalence of pre-diabetes in India is almost from 12 to 14%, which is good amount, and that amount we need to target. So if we are going to target on that particular aspect, then definitely we can reduce the people from becoming a diabetes. So how one can identify these individuals so to have a early therapeutic effect? So one can identify based on certain important parameters. So among the three important things is, one is family history, second is abdominal circumference, and third is patient has a previous history of gestational diabetes mellitus. If all the three things are there, then the chances of getting into a diabetes is more. And what are the symptoms of a pre-diabetes? Symptoms of a pre-diabetes, it consists of a majority, it will be asymptomatic. But if you identify all the persons, there won't be any symptoms, but we need to identify and properly screen all those individuals, so that only we can able to find out initial phase itself and prevent the progression into a diabetic path. So that is the most important aspect for a pre-diabetes individual to target, and further progression you can stop if you are going to early intervene. So the pre-diabetes risk score is what we call as, there is a risk score for that. For that, it contains 3 to 4 criteria. So if the 3 to 4 criteria, based on that, Indian Diabetes Research Society has devised this scale, and among that, the 4 important thing is family history, abdominal circumference, the age, and history of any previous TDM. If all those 4 things are there, then we label it as the person who has pretty much higher chance of getting into a diabetic person. So second important thing is based on the score criteria. If the person's score is between 30 to 50, then he has moderate chances. If the score is more than 50, then he has higher chances. Among the high score, the persons have high prevalence of turning from pre-diabetic to the diabetic. So that is what our Indian data says about. So this is the most important aspect of the diabetic. How one should therapeutically approach person with pre-diabetes. So how one can be prevent from the diabetes, from getting into from the pre-diabetic to diabetes. So that is 2 important things which we need to target. One is a proper intensive controlled diet program as well as exercise program. So these 2 important things which are very much essential, so that we can target this vulnerable group from becoming into a diabetes. So this is more important and crucial role. Diet plays a major role. So what are all the important things? The majority of the questions comes like, what kind of diet we must follow, doctor? So diet which contains, we have to reduce high glycemic index kind of diet. So that is high, rich in sugars, the persons should be follow. So second is, we need to reduce the intake of jaggery, sugar, and high rich in like banana, mangoes, and the fruits. And apart from that, wheat and the white rice, all those things are very much high in glycemic index. We need to reduce those things first. And second is we have to target improve the green vegetables, increase in your diet. So, and also you need to improve a lot of proteins in your diet. So in India, it is more majority we see a lot of carbohydrate rich diet. So if you change this kind of lifestyle pattern, that would be very much important. And also if you have any doubts, you can get a dietitian opinion nearby hospitals and hospitals as well, so that you can know about the diet part, and which plays a major role, so that every individual can fix up a diet program to specific targeting the pre-diabetic people and what kind of diet you need to take, and based on your calorie intake. And the second important is exercise part. So everywhere the exercise is majority, the physical inactivity is a common thing, but if you target the physical activity every day, 30 to 40 minutes of brisk walk should be there. That is what the WHO says and the ADA says. Everybody says that 30 to 45 minutes of brisk walk, that too from Monday to Friday. If you take at least minimum 5 days a week, you should have it, this week physical activity pattern like walking. So other activities you can include like intense activities, sports like shuttle or sports like swimming. All these things also will improve your lifestyle modification. If you are targeting this, definitely there is high amount of chances you won't become a diabetes person. So this is most important and crucial aspect, the diet as well as the exercise part. I personally feel that early detection and early intervention and screening is such an important tool. And if you check your blood sugars at initial stage, and if your fasting level is between 100 to 125, and that means it is impaired fasting blood glucose level, and if you are postprandial after 2 hours of the 75 gram glucose test, if your blood sugar is between 140 to 199, that is also impaired glucose tolerance. So these two persons should early screen the individual so that they can reduce the burden to becoming a diabetes. So those people who are on diabetes modification program, which I have already stated, so at least once in 3 to 6 months they are supposed to check their blood sugars. If they are going to check the blood sugars, because that is the crucial time after the program, and once you have adapted to the lifestyle modification, you need to see the changes. So if you are not sticking it to the property, there is 99% chances of becoming as a diabetes. So follow this program. If we target early, then definitely we can reduce the burden of becoming a diabetes. We can very well reverse the diabetes in this particular stage, that is in the pre-diabetes. And I wish you all a very success in this journey, and I wish you a happy new year to one and all. And thank you so much for patient listening.